any task or duties, happiness and sensorial pleasures in the present. And then for the future, we want to be looking how we can do better. We have optimism and hope for the future. So positive emotions broaden people's attention and thinking, and thought action repertoires under lingering negative emotional arousal, that's it, and fuel psychological resilience. We build personal resources and bring psychological and physical well-being. These trigger upward spirals towards emotional well-being, and thus we seed more of human flourishing. We grow better as a human being. In education, not only are they teachers, educators, the carers, the counselors, parents, it's a whole group of people who are caring for the children, the adolescents, the students. So caring in different ways, but towards the same goal, to bring that child or that student to a better person with better goals and having, feeling accomplished and well. So in these roles, where we find that because the carer, the teacher, the counselor is doing so much, sometimes there is what we call a lot of strain. The load can be so much. There's a big strain. And we find that the more so with the COVID, but prior to that also, because there's been a lack of defining, the roles of each one and how they integrate and the team building in education has not been there. And a lot of them are working in solo. So this is, there are a lot of strain coming to that. And what we found, not only Karasek's model, Karasek talk about the job demands and the control model. So for him, there is a symbiotic association between job demands, such as the intensity and pace of work, and job control, which refers to influence and discretion in relation to personal tasks and goals. So Karasek's model suggests high demands work combined with a high level of control might lead to lower strain jobs. And low demand and low control work is potentially linked to a passive work environment. Harvey and Al, in 2018, they looked at, the risk of increasing strain resulting from high demand and low control work and the effect of this strain on health and well-being. Particularly, they found high job strain appears to independently affect the risk actually, of future mental disorders in midlife. That was done in 2018. And from then, actually, with the COVID-19 now, with the compounded effect of COVID-19, a lot of studies now out on what, the toll on the burnout of educators and carers. So a lot of studies still going on, but still we will see later on, the research, there are a lot of gaps still, which we need to look into. So lots of increase in clinics, in the practical now, where I am, practice shows us a lot of anxiety and depression. I'm astonished by the numbers coming up. And I know from colleagues in the public sector, because I'm no more there, I retired from the public service last year, but the psychiatry departments and everywhere around, seeing people coming in with obviously, presenting more so with psychosomatic disorders, but related to anxiety, panic attacks, different situations, and depression, even to the stage of suicide, have increased lately. So as I say, studies globally are being done, and WHO itself had produced a lot of materials last year, the year before, when COVID-19 started, how to look at psychological effects, how to prevent and support youngsters, young adults, all groups age, actually, females and elderly also, in this pandemic, to help them to get along and move on without having these effects of COVID on their mental state. So what we see also, the carers, the counselors, the educators, the teachers, they're doing a marvelous job. I mean, they're trying their best. They're given with limited resources, I would say. It's not a question of money, but sometimes the logistics are not there. We've seen that in the schools and colleges, and especially in primary schools. Not enough done regarding, the virtual learning, regarding accessibility, regarding the cost, regarding the preparedness. There was no prepared plan. And this is the important thing about our emotional well-being. We need to plan, we need to prepare, we need to train before we get this state of, where we feel we can't do much. So what happens, this is a cost of caring, which is often, equals to compassion fatigue, happens. It is normal. When you look at, most of the caring people, they do that because they want to do it. They love to do it. But at the same time, all the factors around it are not present, and they feel that compounded fatigue, which we know of. So that can be an oxymoron, compassion fatigue, cost of caring, but it's there. And a lot of people it is normal, but it's ignored. So we all, human beings, we have emotional bandwidths, so levels of, and what happens is there's cumulative emotional fatigue. So what happens when we are particularly wanting, to help people, we carers, whether the public servant or being a parent, there's so much we want to do, and we keep adding on. So that sense of cumulative emotional fatigue can develop, obviously, over time. When our emotional bandwidths are overextended and not given a chance to reset, well, it may manifest itself as irritability, decrease in empathy, or even indifference. So at some time, you become sort of emotionally numb. So much fatigue, there's so much doing, but at the same time, you come to the forward, don't know what to do. So compassion, arguably, is a zero-sum game, isn't it? It is difficult for you to give if you're not giving to yourself. Just giving will exhaust everything. Compassion fatigue, often, as I said, cost of caring is normal and everything, but people cannot do it without empathy. So we need to have this in us, to combat this emotional exhaustion. We have to encourage ourselves, people around us, to engage in self-care activities. So as we know, compassion and empathy are human virtues that can be depleted, though renewable. So we need to combat that. As I say, easier said than done, because carers tend to feel guilty taking time away from their work or from their patient or from their client. It feels, we have to do it. There's nobody else to do it. Who's going to do it? There's so many. So we have this belief that, surrounding self-care, if we're going to do something for ourselves, we're going to be selfish, indulgent, or not patient or client-centered. We need this shift in mindset to overcome guilt and manage compassion fatigue. Caregivers require care too. Taking care of yourself is not being selfish. I remember from the first time I was in psychiatry, I was looking at all these parents, people coming around to visit their loved ones in the psychiatric hospital. And, day in and day out, bringing food, being there, doing whatever, and not thinking ourselves. And with the months and with the years, I was seeing these parents, looking at them, you could see that, there's so much on their shoulders, like literally they were bending with, carrying the basket and carrying things and being there and being so worried. And I wondered, how they do it. And I was saying to myself, how long are they going to continue this? And what then will happen to the patient or to the client if that carer is no more? So we must look at it, difficulty and guilt. And every one of them I was talking to, people, well, doctor, I, have to do it. There's nobody else who will. And it's true. Over the years, what I've seen, parents have gone and patients, so I'm talking about my experience here. But where are the others around? The brothers and sisters and cousins and uncles, and everybody were happy, when everything was okay, all gone. No one had the same, obviously, compassion and willing to do something. So we have to prepare that for others because we're not going to be here forever. I won't. And carers have to be helped. Carers, teachers, counselors have to know what's, next. Tomorrow I become sick, I have an accident. Who's going to do that caring? Who's going to be that teacher? That replacement teacher, I found that terrible. When I see replacement teachers, we have that a lot in Mauritius. I don't know, elsewhere. Come up, not, knowing what to do and overwhelm, seeing a class of 30 and don't know where to start and what happened and sort of asking, what did the previous teacher do? How did she or he manage that class? So that preparedness, that planning, that training, which is totally lacking, I would say. So taking care of yourself, you obviously will care better. And this will bring a lot of joy, enthusiasm to what you do. That compassion will take time, as I say, to replenish, but the joy, the caring for one another involves also that kindness, that empathy, that satisfaction which we get. That Freud, when he talked about out of your vulnerabilities will become greater strength. Okay? What he means that, the more the kindness, often forget that, you give so much kindness to do things. But at the same time, you become vulnerable. And you're taking risk at times. Being kind to others is not always easy. And it's not always an automatic reaction. Freud was highlighting that being kind, open, and honest often result in strong character and resilience. So looking at, being yourself, knowing what you're doing, what is your limitation, how much and what do I know? Because knowledge also, knowing about this. For instance, when you're talking of somebody caring for a dementia patient or an Alzheimer's patient, you must know about the disease. You must understand the progression. You must know what to look for. What are the difficulties will come after, because the stages of the disease is progressive, and, each person also will be affected by the disease differently. Same in a child or youngster having a depressive episode could, be managed differently, will be. And at the same time, you have to be prepared to know what to look for in that child. What is that? Why is the attention not there? Why is the work not being? What are the psychosocial components of that child's problem? So being kind, open, and honest will often result in a stronger character, as I say. Resilience will be there. Kindness is a signal, we know, to the brain, isn't it? Releasing serotonin, dopamine, all good, feel-good transmitters, endorphins, which we know lessen the pain, the hurt, and oxytocin, the love hormone, which increases when we're happy, we feel, loved, we feel compassion, we get an increase in self-esteem, trust, connection, optimism. And this is what the young must feel. There must be empathy. There must be kindness in our teachers and counselors and people. This, the whole dynamics, as I see, of education is changing. It's no more that way of, being just didactic, one-way teaching, No. Our youngsters must feel in it, must participate, must be prepared more with this tough, difficult world and competitive world outside. So what we can be kind, obviously, and compassionate to others, but we must be kind, as I say, and compassionate to ourselves. Okay, because if we not prioritize ourselves, this can result in a lot of collateral damage. Kindness is best fostered by being kind to ourselves to sustain our well-being, and being kind to others in order to maintain the cycle. So it is a cycle. It is it's a good feeling that reinforce everything, bring us to that, and we feel re-energized, and we want to do it again, and we want to get up the next morning and go for it and say, I have a task and I have a duty and I feel good about it. So as I say, so I explain about empathy. We see it more in medicine, it's true, patient-doctor relationship. So it is an emotional experience, isn't it? The observer, doctor, and the subject, in which the observer is looking at all the visual, auditory cues from the client, identifies it, experiences it, and, this emotional state. So we sort of put ourselves in that person's shoe, as we say, or feeling the emotions that are there, rather, feeling the real emotions. So I feel there is more to do. The educators today, training, we have to get this to create, for them to feel better, to bring in empathy, to create the safe, supporting classroom environment. How to support students with emotional and mental health concerns. So helping students, looking at them, able to gauge their emotional health will bring so much more, will make our task much easier. Of course, psychotherapy, different sort of individual groups or whatever, will bring a plus in classes or in schools or in, colleges. We can have, all sorts of programs to help children now to readjust to schools, to colleges, because they've been left out because of the COVID, away from school. So there is that readjustment. It's a lot. It's a big work to make that child feel safe and secure about the COVID, that they are not going to catch it, that the teachers are there to help them, that the school environment is okay, that they have connections with their friends. They want to see that. They want to feel humans. We are human beings. We're not animals. We need the social contact. Children need that. They want to see their peers. They want to laugh and scream and do silly things, which is great to feel in that learning environment, to be happy doing what they are, to learn better. So reconnection is important. Teachers have a role to do, to meet parents, to communicate. Communication without, is not possible if we do not have good communication. How can we bring better learning? So these are the things that, we can do, but we can do more. We can promote overall well-being, looking at the whole person, the physical and the mental. You all know anyway that, health is, you cannot dissociate mental health from health. Mental health is part of health. Health also includes emotional health. So all these aspects, we have to look at how we're going to promote better well-being of that person, including all the even the spiritual well-being. So positive engagement, I would think, is, how do each one of us have to work on it. How can I bring in something, a little plus myself? So looking at myself, have I been doing things right? Because we are not doing things. It's a new normal, isn't it? We cannot stay in the past and look at what we have been. We've done great. I mean, lots of teachers and counselors and academics and educators, marvelous jobs. I mean, good. We are the products of this. But reassess, because we have to be strong. We have to be better. We have to be empathetic. We have to be kinder to this group, this new situation. So the institution itself, how can the college, the institution add things, do things better, reorganize itself, replan, redo things? It's got to be different. It cannot be the same. We know that. And it can be done without putting a lot of resources. It's just a matter of organization, of planning. The community, having programs in the community to help out, to reach out for children and parents who cannot attend school, who are not, looking at them. There are difficulties. The socio-economic situations is not good. We are feeling it in Mauritius. Small country, bigger countries, bigger problems. Difficulties in accessing schools, the problems of transport, the problems of now. Climate change is becoming an issue, We are finding that in Mauritius at the moment, having heavy rain, floods, preventing children access to school, preventing access to teachers. The roads are being, all sorts of issues. So how are we going to bring that out to them? We need that rethinking about education in other ways, but at the same time, doing it in the way that we feel satisfied. So the society itself is to be re-engineered, to reassess the situation. What is missing? We will talk about research gaps in a minute, but I just wanted to go now on a few of the projects that worldwide are being done. WHO, UNICEF, they have all sorts of programs about health promoting schools, which are great. I mean, I've heard that since I was a kid. But we need again to reinvent that. We need to look at how it's done. Each country has its specificity. Each place, each society. So these programs are great. But must be commitment, investment in the whole school approach. I'm a very holistic person. I want people to, we are not just a doctor, a carer, a teacher. we are a whole human being. We can give so much. So we can be all at the same time. So looking at this whole school, again, for that child's not only, I know people say, well, they come to school to get, to learn about, English, French, history, geographics, or science, and other issues, social, whatever, are learned at home. But let's remember, we are in different contexts now. Parents have to strive. I mean, lost jobs and difficulties in all sorts. And they count on us. They want us, the school, the community, the institution, to help the teacher to be there. So these programs are interesting, but have to be re-looked. And we know you've heard about the Seligman's PERMA model, positive emotions, reactions, and all that, which are great. But these also have to be re-looked in our today's situation. The program in UK, I mean, NHS, the No Health Without Mental Health, this is great. I mean, this is good program. But again, with resources, you don't have to be a psychiatrist or a doctor to go and talk about mental health. I mean, layperson can learn. Everybody knows what helps and what doesn't help, but there needs to be training, obviously. So mental health, included, when I talk about mental health, obviously emotional health, they must be brought there to our students, to our youngsters, to our people in need. We have a program we've heard of, looking at emotions a lot, which has been the Zippy, Z-I-P-P-Y, Zippy worldwide program, and it has been implemented in Mauritius. It's a school, integrated program which looks at children's mental health, but looking at emotions and getting them to accept, to know about their emotions and to come forward and say about it. It is normal to be sad. It is normal to be angry. It is normal to cry. It is normal to laugh, and it's normal to not want something. So this program has a lot to do with emotions and did very well in primary schools. But here in Mauritius, it was done in some of only the private schools, not the public schools. And I think now they're wanting to do it in the public, which I think is a great thing. So this is something also which helps looking at different emotions of children. School health promotion and empowerment programs, I think that's an Indian project, the SHAPE. And that also, there are a lot of studies done on that. And one of the great professors, Dr. Vikram Patel, has published a lot of articles on that. And obviously, he feels also we need to put more resources there, and we need to do that and bring out to the community this kind of empowerment program so that youngsters feel accompanied and better. So emotional well-being for all of us, what do we need? We need prevention of things. We need to be able to respond better in situations and deal with situations. So 5 things really. Connect. We have to be, to reconnect with our family, with our friends, help us to feel better. We have to be active, not only physically, but mentally, feel great. Take notice, obviously, if, what's happening around us, the environment, what's happening to ourselves, our feelings, all of that will help us to be stronger emotionally and help others. Keep learning. I think we do that every day. This is what we're doing today. But we need to encourage the youngsters, to get more curious, more wanting to do things, change things, remodeling of what's happening, and be creative and imaginative. I think playing, a lot of models which help youngsters to recreate. And they're doing that a lot on digital, technology nowadays, a lot of things that can come up. So I will now, I don't know how many minutes I've got, just to say that research, obviously, this is the last bit. We need to look at more. There are a lot of gaps, and priorities that we can come up in schools and do it, simple things, but look at role of schools in achieving positive emotional and psychological outcomes. there's a need to do that, to look at it. What is the situation and what we can do, how we can do it in schools, in colleges, in institutions, and then relook at prevention. A lot of studies have done, but we all know the models, which one. I mean, different countries, different areas needs different things. And prevention model and how we respond to adverse effects. A lot of abuse going around, unfortunately, with youngsters, a lot of bullying, a lot of difficult domestic abuse, community abuse. So these affecting children and youngsters obviously will impact on their emotional well-being. And then be able, by simple things, 5 questions, questionnaire or screening for psychological and mental disorders. It's not a big thing, but looking at these when young person is there in school, in an environment, rather than let it be, because we all know that unfortunately it stays on, and coming of that age of 30, what I see, 30, 35, and their 40s, all the difficulties that they get, in relationships, in carrying on their professional duties, in their attitudes and everything, and then keep it, getting in that sort of depressive mood. So we want to be positive, we want to bring on change, and we want to be involved. And this is how I think teams have to be built to help us with emotional well-being. That's all I have for the moment, but I will have questions and clarifications if you want.
Yeah, thank you, Dr. Vinay. Professor Malhotra has written that a high demand of the job leads to anxiety, and which results into isolation from self. In such situation, positivity is a big causality. That's the statement made by Professor Malhotra. Vinay has written that in linking emotional well-being with educational practice, how do we do and can we do? Create more awareness in our educational community and mind setting of the cost of staff competition. Like example is examination, ranking, existing structure of incentives, etc. So these are the 2 statements. If you want to add to this, or it's open for discussion now. Any questions from our colleagues who are attending the webinar?
Ramesh made a statement. Ramesh Sharma has a statement.
I didn't see that. Okay, yeah. Yeah, Ramesh has that statement. He has written that there are certain apps like TikTok and Instagram which offers digital well-being settings to keep you from doom scrolling past bedtime. But do they really help you put your phone down and get some sleep? That's what, yeah. Okay.
Well, if I may, if you want me to react, I can.
Sure, Dr. Ameenah.
Can I? Thank you.
Yeah, sure.
Okay, thank you so much. Thanks. Yes, well, I did mention this digital technology. Yes, because we are in a state now, where we need to be, because of the issues of pandemic and so forth. And it's easier, to have, all sorts of courses and programs and to do in your own environment. But you're right. I mean, using TikTok, and they have all sorts of things. But unfortunately, I find they're just there sometimes, sort of make a sensational sort of thing and make people, okay, this is what we're doing, but it's not a continuity and it's not assessing really what's happening. So people feel, a bit lost. And how do you use it? There's not an accompanied, manual sort of telling you, how do I use these digital program or thing. So you're right. The best thing would be sleep and not using TikTok or digital whilst going to sleep. I mean, we all know that the brain needs, so many hours of sleep. So if you're using virtual apps, all sorts of apps during the day and courses and refreshing, fine. But overuse, there's a lot of sort of abuse nowadays, and I find that with a cognitive decline, I'm telling you, the numbers of youngsters coming back with difficulties, sleep difficulty, cognitive impairment, deficient attention, and destructive sort of aggressivity because of the overuse of digital, of the phone and apps. And then the other thing was about lot of job strain. Yes, it's true. If you're having, what we meant to say was high pressure but jobs, but when you have a goal and you're controlling and knowing how to prioritize, doing it right, knowing how to do it, planning for it, so pressure on doing that will help give you a better outcome. But if you're having a lot of pressure from your job, but you're not organized, you're not planning, you don't know how to start, what to do, the control, you don't have control of what's happening, obviously you will feel burnout and fatigue. So that was the thing. So we need to feel, to prepare ourselves, and this is why there's a training and capacity building of carers, teachers, ourselves, on how we go about and how we organize and planification of what we are doing. So thank you. Yes. Others? Anything? But
Hello, I do apologize.
Hello, Dr. Ameenah. It's a pleasure to hear to you. I work in the disability sector. Of course, I'm from the education sector. But now, since '83, I am in touch with doctors, and just now also I attend sessions by the psychiatrist only for one reason, because I think somewhere we all run parallel. Though we are talking about a human being, whether it is a child or an adult or in a different conditions as a student, as a patient or whatsoever, but I think somewhere I like the word which you said, the line between empathy and sympathy. 99% what I find in the field is because the caregivers, even as a teacher, I will say many of my colleagues who started working in this area, though they were psychologists by professions, they could not come and sleep after spending the day in a special center. Looking at those kids, I think that was a very important point when you said the caregivers have to take care of their own well-being. And I think that is a very good message which I will be taking for the in-service education of different professionals which I deal with. And I'm also very happy that you have brought the persons with disability also at par with whatsoever is happening to everyone else. Because when we talk about well-being, somehow or the other we forget about that they also have an issue with well-being. And yesterday on my Facebook also I have pasted a case of a autism spectrum disorder, which is a very challenging thing, which somewhere I think goes over both the medical field as well as the social work, counselors, every field it touches. And those who are undiagnosed, or some of them, they have learned to express emotion because it is socially desirable without feeling. So I'm really very happy to listen to you, and I'm sure I will like to be in touch with you. And perhaps you can also share something which some people have asked. How do we translate all these messages in our day-to-day classroom, right from pre-primary to higher education? That is what we are facing as of today in this country. Thank you very much. It was a pleasure to hear you. And listen to you. Hearing is not a nice word. Listening to you. Then we realize it. Thank you very much. And thanks to ETMA for arranging this. I'm really happy.
Yeah, thank you so much. Her very another important takeaway she said was engage yourself with activities. Now, anyone else? Can we have a comment from, Vinay, please.
Yeah,
First and foremost, I would like to thank so much Dr. Ameenah, not only her skills and knowledge that she shared with us, but the passion she brings to the audience. I mean, the way she really presents all the necessary concepts and, undertaking, it's extremely challenging. But I have a serious concern. My serious concern is that when we talk about emotional well-being, within the field of education, we have to start to act and to think out of the box. That is the challenge. Out of the box means a lot of things. It means first we cannot think in a disciplinary mode. We cannot think of well-being, health and well-being, psychology and well-being, culture and we have to think it in a very holistic approach, as you mentioned. That's number one, thinking out of the box. Because whatever we read, whatever we go through, whatever research we do, whatever policy we take, at local, national, international level, we are still disciplinary oriented, we are still sector oriented, we are still level of education oriented, we are still subject matter oriented. So I like your word, but I want to see it in practice. I like your sentence when you said team building is a necessity. We cannot continue working in solo. You see, that is a very important message, and that's the way the SDGs have been conceived. And emotional well-being fits pretty well there. We cannot, and it is our own mind setting. Our own way of working should change drastically. Otherwise, we can come with very good concepts on team building, empathy, resilience. We can go on with the whole list. That is the breakthrough we have to bring in our discipline, in our work, and in the academia as such. That is the raison d'être of emotional well-being. Thank you.
Yes. Thank you. Well said. Totally. Yes, integrated team building. And as I say, we have to prepare the team with all the partners of education. As you say, it is not education only in schools, learning subjects, the whole education approach coming from outside, from the parents, the community, the society, looking, at education in that different, perspective. Totally agree, Vinay. Of course, this is what we want, but it's very hard to do. I mean, we've been trying, personal experience over 20 years, trying to get this concept, this way in the education sector. It's so hard. I was fighting against permanent secretaries and ministers and, the plan to get that team and to look at how, we can, because we need to help each other to do that. It's not done alone. And this is the thing that they've got to get out of the education is not only the teacher. Education is more, is as I was saying, the carer, the parent, the counselor, the doctor, the nurse, the family social worker. Everyone is concerned with different aspects of education, and this is why we want it. But we have to, as you say, think out of the box and bring something. I hope we can look at the model. Basia probably listening to me carefully here. Please,
yes,
maybe you can add on.
Yeah, can I make a comment? First of all, Madhu, my sincere apologies. I don't know, had emergencies, and on top of that, I couldn't connect with the link, so I got in a state of panic. I sent a message to Professor Mama, and he is so good with technology. He sent me another link, so I'm able to connect. I'm so sorry. They say it's rather late than never. So, Ameenah, my apologies. I missed most of your presentation, but I know you so well, Ameenah. You're such an enthusiastic person, such a respected professional. I have connected with you for a long time. You're very credible, very well supported in Mauritius term in the clinical field and so on and so forth. So I do apologize for missing that presentation. But if you wish me to make any comments on any specific aspect of education, I'm quite happy to do that. But I've got two things in mind about education, which I will, with your permission, I might be able to visit that. So there you are.
Bashir, please go ahead.
All right. When I think about education, rightly so, Dr. Ameenah, you said education is not only in the school. It's very eclectic, very generic, very pluralistic, and parents, communities, friends, family members, and so on, they should all be involved in the field of education. So that's one thing I fully support. And education is not only the 3 R's, reading, arithmetic, and that sort of thing, the academic side of it, but education is very holistic, okay? This is one of the challenges we have in our society nowadays. I think we are far too focused on academic education. Even in Mauritius, making reference to Mauritius, children, I feel sorry for children. You know, they get up very early in the morning, they have got their piece of bread, chewing their piece of bread with their drink, with their bag, rushing to tuition early in the morning. And after the tuition, they rush back home and they go to the school. And after school, they have got more tuitions. Weekend, they have more tuition. I feel very, very, very sorry about this scenario because we are too academically driven. Parents want children to be high achievers with great results and so on and so forth. So that's one dilemma I've got with me. When I talk with young children, young person, they're all stressed out. They're also burned out. So that's one thing. The second thing I'm going to introduce you to the word is a Japanese word. It's called hikikimori. After the war, there was so much upheaval in Japan. Everybody was affected, so confined themselves at home. They confined themselves at home. They were so worried, so scared, and so on and so forth. They didn't want to go out. They didn't go out, so they were confined at home. And so much so that depression set in. Depression set in. And up to now, there is, great results from that. So when I look at what's happening with the children nowadays, especially in light with the COVID-19, the confinement is there. Children are very much confined. Parents are very overprotective. And I think there is the hikikimori concept setting up amongst the children. And they are all in the critical stage of development. So if they're affected now, I put a big question mark. What might be the results? What might be the implication from that in the long term? If they are suffering from this hikikimori type of difficulties, will they be affected in the long term? So that's a question I ask. Okay, so I just stop there for a minute.
Hello.
Hello, yeah, I just stopped here for a minute. So if you've got anything else to ask me, I'm quite happy to do that.
Totally agree. I mean, we've seen it in clinical practice, as I was saying. The numbers of youngsters, and not only children, adolescents, young adults, careers, young people in having this effect of confinement and being unable to do so much, they have been coming to the clinics, as I was saying, not only in the private sector, but in the public sector, numbers of increase in psychosomatic disorders that people will present rather with that, rather come say, I'm being anxious or depressed. They come with, headaches and tummy aches and a lot in youngsters, unable to eat, and all sorts of related disorders, also aggressivity, irritability, the dynamics obviously at home have changed because, they are sort of on top of each other. And sometimes, you have people in small places where parents and children and all that, so they're not having their own space. A lot of issues, as I was saying in the last slide, I was saying, we need more research on that. But there are a lot of studies being done, and we are looking at the increased numbers of anxiety, depression in youngsters, even suicide, attempts to suicide, which, a lot of people, obviously, still stigma, still, nobody wants to talk about it. Obviously, it's not nice, shameful. The effect of COVID-19 pandemic on the emotional and mental health issues are, I think, tremendous. And WHO has quoted that, yes, 1 in 5 persons having mental disorders, increase in mental difficulties because of the COVID. So, yes, a lot of studies, and we need to get this. The data's out there, but, nobody wants to go and pick it up because we are so still, very conservative and very worried of, what will people say. Things can be done. I mean, I was saying we can put up these programs I was talking about, reaching out and being able to assess youngsters earlier, simple methods, simple ways of doing. You don't have to be a psychiatrist, you don't have to be a doctor, lay person can be trained. Simple questionnaire about, how do you feel, what has happened in the past 2 weeks, do you feel angry, do you feel good, do you feel, these are questions, and it's been done everywhere. So there are ways, but it's just a matter of wanting to do it and putting it together, and I hope we can. Thank you.
Okay. Can I, sorry, is that, Madhu, may I just add another comment, please, Madhu? Is that okay? Yeah, okay. I will just cite 1 or 2 case studies. I don't like the word case. When we talk about, when we see the children, when we see the parents, we treat them as a case. I don't like that at all. It's a very demeaning word. It's a very top-down approach. You are the teacher, you are the therapist, you are the medical officer, whoever. So therefore, I'm dealing with this particular case. The moment you talk about the word case, you demean the person, you demotivate the person, and that's it. Immediately, there's a barrier created. So look, I supervised a PhD student from Seattle a long time ago, and he actually studied the phenomenon of case, and he found that using the term case has a demeaning thing, okay? So now, one scenario, when I was in Australia, I worked with a young girl, 8 years old. Parents were very, very, very concerned, very concerned. Mother came to see me and said, I don't know what to do with this girl. She's very naughty. She's stealing from the shops. She's stealing from her friends, from her peers, and so on and so forth. Very badly behaved, won't listen to me, and so on and so forth, or to us. So I said, well, okay, bring her along. We'll have a bit of a chat. So anyway, just to cut the story short, I developed a rapport with her. And so much so that she said, oh, Dr. Basir, and I like you. Can I go home and make a cake for you? I said, oh, I would be delighted. So when she went home, she was making a cake for me. And the mother said to her, oh, can I help you? And the young girl said, no, please, I want to do it all by myself. That's a special present for Dr. Basir. So next time she came down and she presented that cake all wrapped up and so on. So the relationship was already developed. So I used that TAT approach, thematic apperception test approach, and find out what could be wrong. Now, in short, what I found was she was extremely, extremely intelligent, very, very motivated, and her needs were not met at school or at home. So she started to steal, okay? And eventually I worked with her, worked with the parents, and she was highly gifted. So I would have put her in the high gifted category. So following on from that, we discussed approach, and she came good. She came good, and so much so that I said to the parents, do you have a parents and teachers association at the school? I said, well, yes. I said, can you go back next time and propose that you start some sessions or some strategy to look into special gifted children? And they did that. And that was started. So what I'm saying in summary is this young girl was so traumatized, was getting worse, and she was 8 years old. And because of the lack of insight of the parents, detrimental approach was used. So as part of the education, I think parents should really increase the insight into how to detect, the hidden issues, to detect some of these problems at an early stage. Otherwise, more harm could be, could be done. So I'm quite happy to respond on that, please.
Thank you, Bashir. Any other questions or comments from anyone else? Or till the time you can think of or ask questions, we can request Professor Marmar Mukhopadhyay for his comments or idea about emotional well-being.
Am I audible, madam?
Yes, Sahu is there on the line.
Yeah. Yes, sure. Sir.
Please speak.
Yes.
Please speak. We are listening.
I am more particular to know about your experience, Ameenah ma'am, about how to enable our teachers and prepare them for well-being of children. One is at different stage when they go for internship, school internship, and they take some projects from that. How to include it as a part of school internship. And second point is about the professional development project for working teachers at school level. They come across many experiences, but the point is that including it is a part of professional development practices and supporting working teachers to resolve many issues they come across in their school situation. I'd like to know about your experience if you have.
Yeah,
Yes,
Dr. Ameenah, I think
I didn't hear the whole of what Sahu was saying. The noise is there. But I totally understand that what you want to know. Yes, capacity building, we need, as I was saying, to have teams. What they've created is looking at each school, their specificity, and bring a team of support, to not only the teacher, as I say, the only person, counselor, whether it's lay person also, who are willing to help parents, bring a team to that school to be involved in the education of that, of those children, whether their parents support, parents, teachers, association, something like that. But having, a core team who will then be able to be trained themselves, and then train the teachers or those willing around to look at each, of the issues and work it out. Because as I say, each school has its own specificity, each kind, society, the areas around and so forth. So each child has a different problem. So that would be the thing. But to have that, you need, excuse me, you need the approach that directorates and ministries or whoever involved in the system would be interested, willing to do that, because we tend, as Bashir was saying, so much on you also, Vinay, about the disciplinary, the academic, all the pressures of what's happening. And they're saying, we have been told previously, I was told as a psychiatrist wanting to do that, to put up teams to help in different regions of Mauritius, in different schools. I was told, there's no time. I mean, from 8 o'clock to 2:30, they've got so many subjects to learn. They've got so many things to do. Teachers are busy. Children are busy. You can't come in, there's no time for that. So not understanding that you can have integrated mental health or emotional well-being in your developed in your curriculum. You could have that, but the will of wanting to do this and the wanting to put time. People are just looking at, have been looking at only the academic and the competitiveness and ignoring it. But we have to try. I'm not giving up. We have to look at it.
You bring it to
Dr. Sudesh wants to say something.
Yeah. I just wanted to say that I have got another takeaway also from Dr. Bashir, that when we talk about well-being and all these issues, these are not about the persons who have got some deficits, but it is also about the gifted, because in the disability field, 99% of the time we are ignoring the gifted part of it. The second thing I wanted to respond to Dr. Sahu, I also came to all the same B.Ed, M.Ed as all of us we have come. But since 83, I am involved in this field. Why? Because working with community, that was the only intervention which the NCERT or that time in the curriculum of B.Ed was made. And that changed me as a person. So I think the first thing has to start with teacher educators themselves. Well, and that is true for all of us, whosoever is attending here. If we don't have, should, must not going to work, because one need to accept whosoever is in front of that. But for that, the 2 points which Dr. Ameenah shared with us, one was well-being of the caregiver. For me, caregiver is not a profession. We all are in certain ways caregiver. And second is about yourself, and not to draw that line between sympathy and empathy, because sometimes sympathy is more harmful than any other emotion. Thank you very much. I am very impressed by today's session. Thanks.
Yes. So can we come to the end?
Oh, yes, sir. Yeah.
Okay. My comments are, firstly, thank you, Ameenah, for coming all the way to India to speak to us. Staying very much in Mauritius.
I want to be there in presence.
Come.
Please come.
Yeah.
But this is not a very good time, because the summer is coming up and Delhi will have 44, 45 degrees Celsius. Well, I have just a couple of comments. First comment is, whether you like it or not, when the villain wants to become hero, that drama is never acted. When the villain wants to become hero, we are talking about emotional well-being, and we are the creators of emotional stress. When the teacher insists on performance, so much of writing work, and they will be beautifully expressed by Lucy Crehan in her book Clever Lands, where she studied a few of the top Isha performing countries: Finland, Shanghai, Japan, Singapore. Japan, Singapore, Shanghai, highly
There is a problem of connectivity.
Oh, yes.
Yeah, connection look good. Sorry.
It happens whenever I speak, the connection goes away.
You have the magical touch.
Yeah. The most important thing is we need to bring a joyfulness in the learning. UNICEF tried this joyful learning experiment, and it worked very well. One of my own experience, I was in Tamil Nadu. I was chatting with primary school children. So I looked at the map, and part of the map was torn. So instead of torn, I said, who ate this part? So 5 children said, sir, we have eaten. And I said, tell me what was there. So they jumped onto the bench and started telling. So teacher said, quiet. I said, why quiet?
Connection problem.
Said discipline.
Marmar.
I said, police people have been appointed to learning. So Okay, let me see whether I can do it on my phone. Yeah, am I audible now?
Oh, now you are audible.
Okay. So first important point that I was trying to make is that we need to make a difference. For example, Finland, their education is happy and that is the top most happiest country in the world. Why don't we learn from them? Their happy schools are making a happy country. We are not learning from them. Similarly, there are plenty of examples from which we can learn, but unfortunately, we are not trying to learn. Now, my submission will be emotional well-being. First important point is we need to look at the teachers. Teachers are stressed. One very important comment made once by Professor Pathak, who is here today. There was a gentleman who was conducting a workshop for the faculty members. At the end, Professor Pathak made a statement that this resource person had nothing to do. The problem is when teacher or the trainer tries to prove, instead of allowing others to prove, this by Professor Hussain of Stockholm University, former colleague of Binoy, when he talks about equality of education opportunity, makes a very interesting point about genetic differences. Similarly, if you put Adler Jung's work on collective unconscious, it is quite easy to find out that some nations, some cultures are more stressed, less emotional well-being than some other cultures. Question is the cultural difference. I mean, Adler Jung's work, or if you see Martin Seligman's work, there is a lot of possibility that this possibility is there to improve the emotional well-being. For example, one of the things that Binoy talked about, the competitive market. To me, it's a mindset. Some time back, when somebody asked me about long struggle and competition that I had to face, I said, why is the competition? Parents collaborated, so I was born. Sisters collaborated, I grew up. Teachers collaborated, I learned. Colleagues collaborated, so I grew up into profession. I don't see anywhere a word called competition. We have been wrongly planting. Similarly, for example, is it working? Let me change. Now both have started working. The one point that I thought we should mention, one of the important points is, I was talking to Binoy last night and it was a short one-hour chat. I think most of the people take too many things on their plate which they cannot eat. Now there is a way of solving this, and the missing point here, for example, when we talk of continuous professional development, professional learning, you'll see most of the time we are talking of cognitive skill. We are not talking of what Peter Senge used a word called personal mastery. The moment we are able to master ourselves, then this whole factor comes down. I'll suggest to my younger colleagues to see Peter Senge's discipline, particularly personal mastery. Now there are ways of managing, but as I mentioned, that villain is the hero. So hero wants to manage it, villain doesn't allow him to manage. Resultantly, we keep theoretically talking, but we don't know how to laugh, how to smile in a class. Now, a smiling teacher is always much more pleasant, and most of you are so erudite scholar in education, you know that an affective teacher, affective, not effective, affective teacher is more effective. The question is create affective domain in the child, especially insist on the person master concept of, and if you can mix it up with Goldman's work, emotional intelligence. The moment you're able to make emotional intelligence create a kind of a cocktail of Goldman and Peter Senge, I think we'll be able to find a better world, better human beings amongst us, and then Finland will not be able to enjoy its singular supremacy as the happiest country in the world. Then the world will be a happy world. Thank you.
Thank you so much, each and everyone, and a special thanks to Dr. Ameenah for her wonderful and excellent presentation. Dr. Ameenah, you have to say something? Want to add something?
Okay, well, thank you so much, Professor Madhu. Thank you all the professors, Marmar and Basir and Sudesh and Vinay and Dr. Sudesh, yes. All these, I think I'll take on all your suggestions. I've learned a lot more also from you today, and I think that's great sharing. I enjoyed it thoroughly. And anyway, if you want to contact me, please do so. You have my mail, and we can talk again. And I surely will take that invite, and inshallah, September or something, I'll try to come up to see you guys, and inshallah we meet again. Thanks so much, and I pray that you all keep well, and blessings to all of you.
Thank you.
Thank you so much, Dr. Ameenah, for this presentation. It has given us many more things to think about emotional well-being. And if we draw a matrix on one side, various kinds of emotions, whether positive or negative, on the other side, there are more variables like at what level the emotions, at what professional age the emotions, the capacity building, and so on and so forth. So once again, I thank each one of you, and a special thanks to Dr. Ameenah for a wonderful presentation. See you next time on more such webinars on emotional well-being.
Thank you, Madhu. Thank you, Dr. Madhu, for everything, for moderating and everything.
Bye.
Thank you. Thank you. Bye-bye.
Thank you.
Bye.
Thank you.
Bye.
Yeah, thank you.
Bye-bye.